Hi everybody, I'm Dr. Joseph Cipriano, and today our patient here, one, she's a makeup artist, which I found really cool. So now you've been having headaches, migraines.
Yes.
As you're telling me, your migraines, they don't stop.
Right.
You're constantly just pressure, and you always just notice that.
Constant pressure, yes.
Okay. And that's always in your head, in your neck. You feel going down into your shoulders.
Yes.
Okay. Those are going to be the main issues, but you've also been experiencing some low back pain, and then you've been having digestive issues ever since 10 years ago when you had your daughter.
Yes.
Okay. So we've definitely got some issues that we're going to be checking out. We're going to be doing an entire full body, head to toe workup. We're going to do a lot of focusing on in the neck, right through here, through that upper thoracic spine, and then we're also going to be seeing, what's going on down here that's causing that low back pain, and then also what could be causing some digestive issues. So I want you to kind of just fill everybody in, let everyone know how long have you been having these migraines, the last migraine you've had, how long it lasts, just kind of things like that.
The last migraine I've had was last week, but I've really suffered from having headaches since I can't even remember not having a headache. So it's just pretty consistent with my daily life now.
Okay, so last week was a migraine. This one of those where you need to turn the lights off,
Yes.
be in like a dark room,
Yes.
not by anybody, no
Yes.
TV. Okay.
Everything.
Okay. And then even though you don't have that bad migraine feeling, you still have that constant pressure. Right now, currently.
Right, yes.
Okay. All right, so what we're going to do, we're going to evaluate some of these areas. First, I just want to go through a range of motion in the neck. If you to just look all the way down at the floor for me. Is there any pain in doing that?
Yes.
Okay, where at?
Out right here.
Okay, so she's pointing to the base of her neck with this one when she had the pain. If you're to look all the way up at the ceiling, is there any pain with that?
Not as bad, but I feel pressure.
Same spot?
Yes.
Okay. If you're to bring this ear to that shoulder, is there any pain with that?
Yes, right here.
On the right side?
Yes,
Right
there.
Okay. So she's pointing to her right occiput, right up at the top of her spine there. And if you're to bring this right ear to this shoulder, one, it looks like you have more lateral flexion on that side, but is there any pain when doing that?
Right here.
Okay, so on that left side okay, so not up top, but a little bit.
Yes, right here.
Okay, so she's pointing more to the base of her spine on the left side. And then if you're to look over the shoulder, rotate as far as you can. Any pain with doing that?
There's pressure.
There's pressure where at?
Right here.
Okay.
On my shoulders.
Okay, into the shoulders, and then rotate all the way to that side. Any pain with that?
Yes.
Okay.
It's right here.
Where at?
Right here.
Okay. Alright, so she's having, but you can go back to center. As you can tell, just with going through range of motion, she's experiencing some type of issue, if it's pain, if it's pressure, in every range of motion that we went through. So, what we're going to do, I'm going to have you first lay face down for me. And we are going to check everything out here. Okay. So one thing that I'm going to be doing that I do with every patient is I scan the entire body. We're looking for that symmetry. So what we see on the right side and what we feel on the right side, we want to feel the same on the left. So we're going to start in the neck. Yeah, definitely feeling tightness. Well, they're on both sides of the neck, but I know for you this is unfortunately a common thing. Okay, yeah, even through the traps, a lot even right in through here.
Yes.
Okay, you notice that little bit?
Yes.
I mean, to be honest, I'm not even pushing in that hard.
Yeah.
It's that entire trap, so yeah, going all the way down. How's it feel just through this upper back?
Okay.
Okay. So at least not feeling too bad right through here. I'm not noticing that much either. That's why I figured I would ask. A little bit of right in here.
Yeah,
okay.
right there.
Right there. Yeah, feeling like a rib is pushing back at me through here because I'm off the spine. I'm off to the right. So what I'm feeling feels like one of her ribs are just a little bit out of alignment here. So we're gonna go through. We'll get that back into place too. So I went through the cervical spine, going through the thoracic. Now we're coming into the lumbar spine. So this is gonna be the area that's gonna be controlled by that digestive system. Okay. Any pain in there?
Yeah.
Okay. Which side?
The right side.
Okay.
Yes.
So she's feeling pain on that right side, and I mean I'm barely pushing in. There's really no force at all here.
Right there.
Right in here too?
Yes.
Okay. Okay. Any pain over that right SI joint?
Yeah.
Okay. What about the left side?
No, not as bad.
Not as bad? And then what about directly over the sacrum?
Yes.
Okay. So we have pain directly over the sacrum, pain on that right SI joint, pain coming down throughout the thoracic, that lower thoracic spine and that upper lumbar spine. So those are areas where nerves are going to be going directly to, different organs. If it's the stomach, the small intestine, large intestine, all to that digestive area as well. So we're going to come all the way down here and we're going to take a look at her leg length. As we can tell, we've got a right short leg. When we look up and scan the body like this, we're noticing the right side is up a little bit higher through here, and then also that spot in the ribs as well on that right side. Those are going to be the main areas that I'm noticing. So we're going to go ahead and we are going to start the adjustment. So I like to start everything up here at the top of the table. We're going to clear out that cervical thoracic junction, and in your case this is going to be probably a very big release, and it's where you hold a lot of your tension at. Good. We're going to get the other side here. There it is. There it was. Yeah, very tight right in through here. Let's get things loosened up. So we are going to use a portable massage device. It is the Hyper Ice that I like to use. So we're going to first start, let's get everything a little bit more relaxed. Okay, so with this, what I'm doing is we want to get these muscles and tendons, kind of get that inflammation down a little bit. So what will happen is it'll make the adjustments easier for myself, and then she'll also be able to hold the adjustments longer. How's that feeling through here?
Great.
Yeah, she's really got quite a bit of knots in here, a lot of tension that she's holding through here, so got to spend a little bit of time, which I don't think she minds, probably feels pretty good. Yeah, usually it isn't until we get lower in here is where it can hurt a little bit. And I know through here we are having some of those issues when I was just pushing in and palpating, so how does that feel down here?
That's okay.
Okay. How's that feeling in the low back?
Yeah.
Okay. There we go. Now we're getting some areas a little bit more relaxed. So now we'll be able to make those adjustments a little bit easier here. Okay, what I'm going to have you do, I'm going to have you take a deep breath in and exhale all the way out. One more time, deep breath in. Exhale all the way out. Good. I'm gonna do one more, a little bit lower. Deep breath in, and all the way out. There it was. Okay. So before I do side posture, I want you to sit up for me. I want one leg on either side of the table. Good, just like that. So what was happening, especially on that right side right in through here where you're having some issues, it's kind of popping out a little bit towards me. So what we're going to do, have you give yourself a big hug here. So I'm going to rotate you to this side. Now your thighs, I want you to just squeeze them to the table. I want you to look as far over your left shoulder. There we go. I know you felt that one release pretty well. Good. A little bit right here. We're going to turn to this side. Good. Okay, leg back down. What I'm going to have you do is lay flat again for me. Okay. So now what that did, that helped clear out a little bit throughout that thoracic, and then we started getting a couple of those upper lumbar vertebrae as well. So what we're going to do, check the sacrum, because you're having pain directly over the sacrum here. So I'm going to stabilize on the sacrum, and I want you to raise this leg up as high as you can for me. Is there any pain, tenderness, tightness with that?
Tightness, yes.
Alright, relax that side. Raise this side up for me. As high as you can. Okay, any pain, tenderness, tightness?
Tender, yeah.
Okay, so both were quite low with doing that. So we're going to do the sacral adjustments on both sides to help loosen everything up. We're going to start with this side first because this side did not raise up as high. What I'm going to have you do, I'm going to have you cross this foot over that foot for me. With your arms here, I'm going to have you put them right there. Good. Okay, so what we're going to do is her sacrum, it's almost like being locked on both sides. So I'm going to do the torquing drop, and we're going to do some on that right side, some on the left side, so we can break up some adhesions in this low back area. Okay, I'm going to have you switch your feet, just like that, good. Good. Uncross. Okay. So what I want you to do, I'm going to stabilize. I want you to raise this leg up as high as you can for me. How does that feel?
Better.
Good. It's up higher too.
Yeah.
Relax that side. Raise this side up for me. How does that side feel?
Good.
Got it. Alright. So what I'm going to have you do, I want you to lay on your side and face me this way. I'm going to bend this top knee. Keep that bottom straight. There we go. I'm going to roll you over towards me. There it was. Flip to the other side for me. Good. Bend that top knee. I'm just going to roll you over right there. Good. There we go. Lay flat on your back. Okay. So while we're down here, we're going to take a look at that leg length. It actually isn't looking bad, which is a good thing there. So originally she was pulling short, but now things are looking balanced. What we're going to do though, we're going to do a leg pull just because you were having quite a bit of issues in both those hips. So all you got to do is just stay nice and relaxed. Good. You felt that release?
Yeah.
And do one more here. And you felt that one all the way up?
Yeah.
Okay, good. So I'm going to have you come on up. Come forward for me. Good. Okay. So now we got a lot of that lumbar spine, all cleared up, the hips, the pelvis, the sacrum. Now we want to work on a little bit more in that thoracic and then up in the cervical spine as well. Okay. So a little bit difficult in turning to that or flexing to that side. Yeah, a little stiff as well. Get this out there. Yeah, definitely a little stiff. Okay. What I want to do, just because that rib I was feeling out, I'm going to have you stand up. And I'll have you stand right in front of me. So we're going to do that standing intercostal adjustment. Just want to make sure we get that back in alignment. Bring your arms out by your side. Oh, let me put my hands under first. Good. I'm going to lean you back under me. And bring your elbows together.
Oh.
There we go.
Yeah.
You felt how that
Yeah.
went? Okay, good. Alright, take a seat right here. Okay. Good, not too bad to there. How's that feel in the hair?
Yeah, better.
Good. Okay. So I'm going to do one more adjustment in the thoracic, just because I really want to make sure that's clear down. So we first did a prone PDA adjustment, then we did a standing intercostal. Now we're going to do a supine adjustment here. So I'm going to have you take a deep breath in and exhale out for me. Good. Already cleared out. I'm going to have you relax down right here. So this is going to be where you're going to get a ton of release, considering her neck was extremely stiff. So we're going to do the Y strap today. That's that manual decompression. You'll feel that in that occiput going all the way down. So I'm going to put this up and over. If you can pull your hair through for me. Okay. And then if you want to come in. Perfect.
Oh, wow. Oh, wow.
Relax for a moment.
Wow.
How did that feel?
That felt good. Yeah.
You felt how everything just
Yes.
released
I
with
feel
that?
it right here.
All the way down to
Yeah.
the low back. Good.
Wow.
I'm going to sit you on up. Yeah. That's why once we get everything nice and aligned, I do that manual decompression, and that thing you just
Yeah.
all the way
Wow.
down. How's your neck feeling?
I mean, pretty good. It's still a little tight, but.
Everything just give it a little bit.
Yeah.
Everything just got,
Right.
really.
It feels a lot better.
No, that's good. Yeah, so how would you, one thing that I always like to ask, if you've never had this done,
Yeah.
how would you describe this to somebody?
Oh my God. I don't think you can. That just felt so good. All the way down. All the way down. Yeah.
Good.
That felt great.
Good. Perfect. So yeah, with that, just because you get so much movement with that, I do tell patients, if need be, make sure ice a little bit tonight. You may feel like a soreness, not like a bad, but first time working out in a long time, like a soreness like that. You may get that just a little bit, but the following day after, about 48 hours after, everything is just
Great.
yeah.
Awesome.
So that will definitely help quite a bit. Couple things that I want to keep up with you on is one, kind of always let me know, monitor those headaches, migraines, things like that. How's everything feeling currently right now?
Right now it feels really good. Like a release, I have a little bit of relief right now.
Okay, so no pressure on your head how it was?
Not right now.
Not right now?
Not at all.
Good. So definitely let me know how long that stays for you.
Okay.
The whole point obviously is for you to feel like this,
All the time,
all the time. But in the beginning, it can take a little bit. So keep me updated. Let me know, and then also let me know even with digestive issues. We can go through and if we need to focus on a little bit of dietary type things, and we'll go
Okay.
over that. But yeah, perfect.
Great.
If anyone is looking to schedule an appointment, just feel free, email me. You can go on my website, drjosephcipriano.com, schedule an appointment from there. Have a good one, everybody.